all afferents which are received by the anterior or pectoral group, the posterior or scapular group, or the lateral or the brachial group, are sending efferent to a new group which can be seen in the base of the axilla. This group is known as the central group. Now, one more group, because there are 5 groups. We have seen anterior, we have seen posterior, the lateral, and the central group, which is receiving the limb from all 3 groups: the lateral, the anterior, and the posterior. Now, medial to this terminal part of the axillary vein, here we can, when we remove this part of the vein, medial to this vein, this group of lymph nodes is known as the apical or the infraclavicular group of the lymph nodes. The apical or the infraclavicular lymph nodes. This group is receiving the lymph from the central group of the lymph nodes, which is receiving lymph from anterior, posterior, and lateral. Finally, these all are draining in the infraclavicular or the apical group. But the apical group is also receiving some lymph directly from the breast. And this central group is having some clinical importance. The intercostal brachial nerve, which is continuation of the lateral branch of the intercostal cutaneous nerve of the second intercostal space. So intercostal brachial nerve, which is innervating the cutaneous nerve supplied to the base of the axilla and the medial side of the arm. Intercostal brachial nerve is passing through, coming from the second intercostal space and passing through this central group. This is intercostal brachial nerve. So what happens when there are some diseases of the breast, like the breast carcinoma? These lymph nodes are enlarged in size. Due to enlargement of these lymph nodes, there will be compression of the intercostal brachial nerve, which is bringing the sense of pain, touch, temperature, pressure from base and medial side of the arm. So referred pain of the breast carcinoma can be felt in the medial side of the arm and in the base of the axilla, between the anterior and the posterior axillary folds. So the referred pain is due to enlarged central group of the lymph nodes, which will compress the intercostal brachial nerve, which is innervating the base and the medial side of the arm. So this was the anatomy of the axilla, a pyramidal space, truncated pyramidal space. Now in my next lecture I will talk about the brachial plexus. In brachial plexus we will see the cords, trunks, roots, and the branches, which are again in relation to the axilla, especially its infraclavicular part.